questions and comments when it comes to your mouth area. And a lot of times, I think whether or not you had a bad experience as a kid with a dentist or something like that, it kind of evolves into something that's even a scary feeling when you become an adult and you visit the dentist and the dentist says you need to go to see the endodontist because I think you need a root canal, and all of a sudden the red flags just go up. So how do you deal with people when they come to you saying, I'm afraid, I'm just going to tell you right now? What do you tell them?
I get it every day. You know, first off, I sympathize with them or empathize with them because I am too. I don't like the dentist at all. They terrify me. You know, and I just basically just kind of assure them that I'm going to let them know everything that's going on. I let them know that my share in their fears, and I basically tell them what to expect. I don't exaggerate it. I keep everything as honest and as I possibly can, and I think that once they get to the point where they allow me to give them the topical anesthetic and I go in there and I get them numbed up and they didn't feel that part, they pretty much trust me all the way at that point. I kind of like it when they come in a little bit apprehensive because it gives me the opportunity to show off a little bit. Right. And I love it when they leave and go, my gosh, that was a great experience. And you know, it's not just me. I think a lot of the general dentists are out there as well. You know, different techniques have kind of come into light. Schools are teaching the newer techniques, and everybody seems to be doing a better job than before. Right.
Okay, well, we're going to go to the lines right now, and Paula is on the line with us. Good evening, Paula. Thanks for calling. Do you have a question or a comment for Dr. Horwat?
A couple of questions. How are you all doing this evening?
We're excellent. And we hope you're doing well, too.
I hope so. There's questions I have to ask. Number one is I have what you call TMJ, where my jaw pops, and my question to you is, who do I talk to? Because first off, I had my primary care doctor to write a letter, and my insurance company still denied. Who do I direct the question to, and how could I get this? I know I have to have a mouth guard. That's my number one question. Second question is, what do you do for adults that have I have a missing tooth that I had extracted years ago, and I had a partial. What do you do for that situation? It's at the bottom, and my teeth have shifted. Those are two questions.
Okay, a couple
things. You can respond to those, please.
Sure, absolutely. TMJ, it's actually, they now call it TMD, temporomandibular disorder. TMJ is a temporomandibular joint. It's your joint's right here. It's probably the most complicated joint in your body. I think it's probably number one. I think the knee is number two. It's a really, really complicated joint. There's a bilateral disc, or there's a double disc going on in there. And gee, almost 40, maybe 50% of the people out there have some sort of problem with them. You know, the way the good Lord created our jaws, they don't line up exactly the way they should. And people have crowding going on in there. And when things are off a little bit, your muscles will overcompensate for whatever discrepancy is in there. From my experience, I really don't see a lot. I hate to say it, but there's not a lot of, I don't have a lot of confidence in a lot of the surgeries that they do with the temporomandibular disorders. But I'm also out of the loop a little bit. You know, I don't know where they've gone with that. If you're wearing some type of partial denture, that's likely contributing to it, if not flat out causing it as well. There are things that you can get that I know that help out very well. There's something called an NTI, Nancy Tom Igloo, NTI device that goes on the front teeth, and it kind of resets those muscles that I was talking about. Again, the muscles, a lot of times people think it's a problem with the joint, but it's not actually joint related at all. In fact, oftentimes it's actually the musculature. And when the first thing you do want to do is go to your primary dentist, your general dentist, explain to them what your concerns are, and then you're going to want to see an oral surgeon. I think the oral surgeons at this point are most qualified to do the testing, to go and let you know what your options are. Even though, you know, before you get any type of surgery, if you do that, I know that people are paying tens and thousands of dollars for these surgeries, and I spent a lot of time in the surgery department at the University of Pittsburgh, and I've got to see a few of them. You know, it is an interesting surgery for sure. I don't think I'd want it done on me. You know, I'm not confident that it works. I know that the people that I've talked to that have had it done tell me that it didn't really resolve their problem. So, I wish I had better news on that. But again, I haven't been around that in a long time. But check with your general dentist, get a referral to an oral surgeon, and just find out what your options are. The NTI device, I have made a ton of those, and when I was practicing in Maryland, and I can say with the utmost confidence that they definitely work. I gave my patients a guarantee on every one of them that I've made, and no one's returned one. And But I think that it only lasts for the short term. I think it'll give you some resolution for at least a good 6 months or so, or maybe even a year. But the TMJ problem may or may not come back.
And then what about the, oh, go ahead, Paula.
You were asking me, telling me about this device. You said it's an NTI device?
It is. And I don't know that it's going to be applicable to your situation. What it does is it resets the musculature. You know, if you take a pencil or you take a pen and you put it on the back of your mouth and you bite on it, you can feel the muscles tense up. They'll bulge out a little bit. Well, if you put it on your front teeth and you do the same thing, you won't feel those muscles tense up anymore. Those muscles aren't being used anymore. And it's kind of how the NTI device works. When you go to bed at night, it kind of separates your teeth and it gives your teeth something to rest on, and it just kind of resets everything for you. And I personally think that the results are phenomenal. When I first started doing it, you know, I thought it was too good to be true, and I told the patient, hey, listen, I'm going to try this out. Tell me what you think. The patient came back in. They were blown away. Every patient that came in, we were blown away. Now, I got into endodontics. I kind of got out of dentistry after I was only making the NTIs for about 3 years. So I can't say that I've, you know, I don't know the long-term results of it. And I've spoken to other doctors that do it as well, and they told me that the problem does come back over time. But I don't know if that's consistent or not. I really don't know the answer to that.
And then the second part of the question being on the chipped tooth?
No, it's a tooth that extracted years ago, and I had a partial, and I lost the partial. I never did do anything else about it, and my bottom part of my teeth, they have shifted, and I was trying to see if there was some type of thing. I was told that they have adult braces that could get that, get a resolution to that.
They might, but that might be a little bit costly for you. You know, braces are going to be expensive whether you're putting on, if it's on 4 teeth or on 16 teeth. I don't know that I would go the braces route, but again, look into it. I might not be the best one. I might not be the most qualified to know the answer to that one. But if you are going to wear I think lower partials are a nightmare, personally. I don't know anybody that likes their lower partials. If it's in your budget, I would do the best I can to try to get some type of implant retained partial. It's a little bit more expensive, but I'm confident that you'll like the result much better. And what they do is they put 3 or 4 implants on your lower jaw, and then the partial itself will snap into place. And I know that I've spoken to patients about it, and it's a major upgrade with regard to your quality of life. So check into those a little bit. I wouldn't think that would cost much more than having braces put on, to be honest with you. But without seeing it and looking at x-rays, I don't know what your options are. But check with a general dentist and just find out what your options are.
Okay. Thank you for your honesty and your help.
My pleasure. I wish I could help more.
Paul, we appreciate you calling in, and have a great evening.
You too. Thank you.
You so much. All right, so I think that's often some of the best advice is just, as you say, when you have a situation like this, do go in with as much information as you have and talk to your dentist and see what the recommendation is.
Find out what your concerns are. You know, it's really difficult in dentistry to keep up with the literature. I mean, it's evolving 2, 3, 4 times a year. And, you know, now that I'm doing endodontics, I can put my primary focus on endodontics. But when I'm talking to the general dentist and I go to study groups all the time. And when they're telling me their techniques and what they're doing, I mean, I haven't been out of dentistry that long, but it is evolving nonstop, and you never know what kind of technologies are out there. The only problem is that with newer technology it gets more and more expensive. You know, people always want the most modern technology, and it's just hard to provide that sometimes. Insurances they're not always on the game. Back when I placed implants, insurances wouldn't touch them. They wouldn't provide any help whatsoever. Nowadays, insurance help out a lot. Once things are time tested, I think that the insurances are kind of helping out as well.
I always like it when you're here, Dr. Horwat, because not only were you able to address a lot of the questions that people have as far as what they would and should ask the endodontist, but as you said, you started in dentistry, as often happens, then you became an endodontist, you went back to school. How many years did it take you from the dentistry into going into endodontistry?
Well, I got out, I did general dentistry. I practiced only general dentistry for about 6.5 years. And then when I went through my residency program for endodontics, when I saw an opportunity to go into endo, I couldn't say no to it. I took it. But I also, even though they don't like you to do it, school's expensive. Dental school is very expensive. Endodontic school is very expensive. So I was moonlighting. And so total, I practiced 9 years. Doing general dentistry and doing root canals that whole time, and I think it's a wonderful profession. I absolutely love it. People call in with the dental questions, and I wish I could help more. And there's things that I'd like to tell them, but I feel like I don't want to say the wrong thing just yet. But normally I go home, I watch the show, and I'll write down the questions that they ask me, and I'll also look things up as well. So this is an education lesson for me as well. You know, my primary focus has been on endodontics for years now. And
for those just tuning in, as far as what the endodontist does, what normally, I mean, I know we often talk about the root canals, but let's kind of talk, what is the study of endodontists do?
Endodontics is you're studying what's going on in the inside of the tooth. You're basically looking at the pulpal tissue, the nerve tissue, and that's basically what you're doing. We primarily do root canals. We do root canals, we retreat root canals, and we're working on the pulpal tissue. And that's generally what we do.
And I know sometimes when someone says, we were talking a little bit about this earlier when we said, you know, can you recover from, you know, and not need a root canal even if you think you do at one point? Is it possible that if you don't have it treated, you need a root canal, and yet you're choosing at this point not to, that infection could spread other places, like to the bone or something like that?
That's a great question, actually. You know, it's a debate. To answer your question, it's really no. It really can't. The periodontist and an endodontist, a periodontist will study the gum tissues, and endodontist will study what's going on the inside of the root. I've had multiple people in residency programs tell me that a periodontal infection can cause an endodontic infection. And when you read the endodontic, and I've read the literature, and sure enough it says it does, and then I read the endodontic literature and it says it can't. So I don't know where to go with that. Now, what we've concluded over time and looking at the credible resources is that if you have an endodontic infection, and that's when you have pocketing in your gums and things like that, when you have the nerve going down the tooth, the primary nerve, the nerve proper, you also have these branches going off in different directions. And as you have a periodontal defect or you have pocketing in the tissue, as it's getting those lateral branches of the nerves, it really can't kill the entire pulp from that area. It can cause inflammation for sure. It can cause your tooth to be irritated, but it can't outright kill it. If it gets to the primary nerve source, the primary blood flow at the tip of the root, the apex, that's when it can kill the tooth. So a periodontal infection can kill a tooth and cause but if you get to that point, chances of you being able to keep the tooth aren't very favorable. You know, you can get the root canal, and you should. You can get because it's always better to keep your teeth if you can keep them. As soon as you lose a tooth, you start losing bone. It's just a chain reaction of problems you're going to have. So unfortunately, you should get the root canal. You should get the deep cleaning, and we should see if we can't get a good result for you. However, if you do have a tooth with an abscess, it really can't kill the tooth next to it. It just, I mean, I think hypothetically or theoretically it probably could, I guess, if it was a scorching bad infection, but more likely than not, if it's going to spread like that, it's going to put you in enough discomfort to bring you into a dental office, and we're going to catch it before it does anything like that. I don't believe that one tooth can kill the tooth next to it. Most of the literature that I've read supports that a tooth that has an abscess can't cause an abscess in the tooth next to it, but I've had so many people tell me that I'm wrong. I go back to the literature, and the literature says that it can't. So I guess it's a debate, kind of.
Right, right. Well, I tell you what, if we are going to take a break, but if you do have questions, and like I said, we talk everything from dentistry to the study of endodontics to when you go to see the endodontist. If you have a question, just jot that question down and give us a call at 737-7587. We'll take a break, and we'll come back with your calls right after this.
Yeah.